Painless, I would say sensory ataxia in a patient who with a history of painless chancre over the penis. Diagnosis: tabes dorsalis. Secondary to tertiary syphilis. Okay, tertiary syphilis. This is just like a good reminder that syphilis is divided into three stages. Number one is primary syphilis. Syphilis, you're gonna have like a painless chancre. Okay, remember it's going to be grayish appearing with an indurated border plus painless inguinal lymphadenopathy. Okay. The second stage is basically you only have like painless chancre in the primary syphilis stage. Secondary syphilis, you're gonna see basically rash over the palms and soles, and you're gonna see condyloma lata. This looks like warts, and remember warts are condyloma acuminata, secondary to HPV. Okay. The third thing that you see in syphilis is basically tertiary syphilis. Okay, so you basically see thoracic aortic aneurysms, basically secondary to obliterative and arteritis of vasa vasorum. Okay, second one is basically just like you guys said, tabes dorsalis. Third one is basically what you see is basically Ergil Robertson pupil. Okay, how what is the buzzword for this? Ergil Robertson pupil. Any ideas here? What is Ergil Robertson pupil? Okay, light. It's called light near dissociation. Okay, you got it flipped. Okay, Lana, it's a pupil that doesn't react to light but reacts with accommodation. Like what you basically do here is that, so let's say this is like the torch and you like shine it over my eye right now. In normal physiology, in you and me, my pupil should constrict, but in these patients the light, in response to the light, the pupil will not constrict. What would happen is that next step I would do is I'm going to take a pen and I'm going to tell this patient to focus on this pen, like I'm going to put it in the middle of his nose, and I'll basically take the pen closer to them like this, and with accommodation his pupil is going to constrict. Okay, so this is called light near dissociation. With light it wasn't reacting, but when I took an object near to their eyes, their pupil constricted. Okay, is this clear? It does not accommodate to light. Okay. Then the important point I want to discuss here, because this is something that trips most people up. See, they can easily literally give you a question and a picture like this and then tell you what the hell is going on. Okay, so whenever you see like a patient, whenever you see like this biopsy finding or whatever, the normal area is that area which basically stains with this. These dark things that you see, we basically apply a specific stain. If the area that takes up the stain, that area is normal and functional. Okay, so see in these patients, the anterior horn, everything is normal. Only area that's like not taking up the stain is the posterior column. Okay, this area that you see. So just like I've written here, this is the affected area. And in syphilis, you basically have demyelination of the posterior column only. That's why basically they have sensory ataxia, because their dorsal lemniscus is not working. Okay. In tabes dorsalis, you will see positive Romberg sign. What is positive Romberg sign? What is positive Romberg sign? What is positive Romberg's? Anyone? Lift? No, it doesn't. Nothing hurts. The idea is like what you basically do is that you're going to make the patient stand, his back will be towards your side. Okay, so let's say this is the patient that I'm basically making this patient stand, and I'm going to stand at his back. First, I'm going to tell him to like stand normally with his eyes open. Then I'm going to tell him to close his eyes. Okay, if he has an ataxia and his eyes are closed and he doesn't fall off, that basically means it's a problem within the cerebellum, and it's going to be a negative Romberg sign. Okay, but if he's standing like this and I tell him to close his eyes and then he falls backward, this is a positive Romberg sign, and the cause of ataxia is the dorsal column, just like in patients with syphilis, tertiary syphilis. Basically, this is the area where the dorsal lemniscus passes upwards. So you have demyelination here. Okay, so it's going to be positive in patients with dorsal column demyelination. I can easily give you another example. Where else would it be positive? B12 deficiency. In B12 deficiency, you have like elevated levels of methyl malonic acid. That's going to basically demyelinate your posterior column. Okay, so again, if I make this patient stand and I stand to his back and I tell him to close his eyes, and he's gonna fall off. That's a positive Romberg sign. If he didn't fall off, it's gonna be a cerebellar problem, and it's gonna be a negative Romberg sign. Okay, is this clear, or do you want me to repeat myself? Is this clear? I want to type this up. So for completeness sake. Okay, I want to type this up. What you do is basically make the patient stand. His back is towards your side. Then you instruct him to close his eyes while standing. And remember, whenever you do like a Romberg's test, the patient's presenting complaint will always be ataxia. They have walking problems. So the baseline is always ataxia and the ataxic patient stand. Okay. Then he doesn't fall with his eyes closed. The likely cause is cerebellum for the ataxia, and this is a negative Romberg sign. He falls with his eyes closed. The likely cause is basically dorsal column demyelination for his ataxia. So look into tertiary syphilis and B12 deficiency. Okay, is this clear? Remember, the part of the spinal cord that takes up the stain, that's absolutely normal. This area did not take up the stain. This basically means you have a problem within the dorsal column. I can easily give you an example, and another example. This is the area where your spinocerebellar tracts are. So if this area does not take up